Hi everybody, thanks for joining us. I'm Dr. Chip Szymanski. I'm a chiropractor for 20 plus years. Today, I'm going to be treating Miranda's plantar fasciitis. We're going to be walking you guys through on how to strip out the bottom of the feet for people to have plantar fasciitis, and also kind of show you how we go about also attacking the Achilles tendon and also the calf area. Typically most people think about it just feet or foot problem, but oftentimes plantar fasciitis also can be exacerbated by tightness in the Achilles. So first thing we're going to do is pretty much kind of walk you through on how we look at patient that comes in and do it like a quick examination on how to read some of the signs on the feet and with regard to the positioning of the arch and also the flexibility in the Achilles. So the first thing we'll do for Miranda's foot is, as you can see, she has a pretty high arch, okay? So typically what that let us know is that when she's very, very active, by the way, that when she starts to put stress on it, you can see all these fascia and the tendons and everything, and the arch will oftentimes get more stress, okay? And over time, that would put a lot of stress here and it pulls on the calcaneus, which is your ankle bone here, and all the fascia and the tendons here gets literally frayed or get strained, all right? And when you do that multiple times, guess what happens? You're gonna develop tendonitis or more fasciitis in this area. So the fascia gets really inflamed. So what we're gonna do is we're gonna strip this area, and as you can see here, when we bring her foot into dorsiflexion here, we're trying to see if the tightness in the Achilles, and she's pretty stiff and tight here. We want her to have a little more flexibility than that. So we're also gonna strip these, the Achilles and also the calf and the soleus out for Miranda too. So just to give you guys a heads up, it is very, very painful when we do this. So she's gonna be squirming quite a bit. Typically when we see a patient squirm around, we're gonna back off, but the key is to really go firm with of course without bruising or hurting them, but it's still gonna be pretty painful. All right, so first thing we'll do is I'm gonna walk you guys through here. We're gonna attack just the lateral region of the calcaneus and the leg here, all the way through here. How are you holding up there, Miranda?
Okay.
All right. And go to the medial portion here. Good. And we're gonna have you do some isometrics. Go ahead and push against me, please. Good. Keep going, Miranda. Nice job. Again. And relax me, Miranda. Good job. Good. Keep going. And relax me, Miranda. Good job. And also gonna do some deep pressure on here. I'm gonna strip the Achilles out a little more. And hard to see here, but I'm also tractioning her ankle out at the same time I'm doing this, okay? So we're mobilizing that joint quite a bit, and she's getting pretty sore here, so we're gonna back off a little bit. And nice job, keep going. Good. After that, we're gonna check the dorsiflexion a little more, and you can see she's gonna go a little bit further right there on you. So next thing we're gonna do is strip these muscles, the fascia here on the ankle. And I'm going to bring it all the way up so you can see here. I'm going to put pressure right at the base here, attachment. When people get older, of course, they get spurs right through here too. She's not there yet, but you can see she's had a lot of stress in this area here. Push up on me right there, Miranda. Good. And again. Good. One more time, please. And relax me. Good. You can see we're trying to get that stretch out to relieve this tension quite a bit. Typically, after a few visits, you're gonna see this flatten out a little more to have a nice neutral arch instead of a hypertonic, okay, or a higher arch in there. So, of course, people that have flattened arch will also have the same thing, right? You're gonna have more stress in this area or lack of support, and then they're gonna develop the same issues, okay? Go ahead and resist it for me right there, Miranda. Good, one more time. And relax for me, please. Nice job. Last thing we're gonna do is I like to just grossly adjust the ankle to finish off the adjustments for her. Hold it right there for me, man. Good. Good job. All right. So thanks for joining us, and please subscribe to our channel if you like our content. And if you guys have any questions in the future, please let us know, and we can hopefully help you guys out. So hopefully you enjoyed this video. Thanks.